My name is Jeremy Peterson. I'm a student physical therapist at Campbell University. Today, I'm going to demonstrate a particular movement and strengthening technique utilizing the therapeutic exercise approach, proprioceptive neuromuscular facilitation, or PNF. The principles of PNF can be applied to numerous gross motor patterns. Today, I'm going to use one of the diagonal patterns, D2, for the lower extremity. And I'm also going to use the strengthening technique, repeated contractions, also known as quick stretch. Initially, I want to demonstrate the diagonal pattern to the patient. This can be accomplished by moving the limb passively while giving simple, concise, verbal description of the movement. So for D2 flexion, I want to move the limb into hip flexion, hip abduction, and hip internal rotation. And then for D2 extension, it's going down into hip adduction, external rotation, and hip extension. Simultaneously, coming into hip flexion, the ankle is going into dorsiflexion and eversion, and going down into plantar flexion and inversion. Now, when doing these movements, we want to ensure the distal movement is occurring first. So we want to have the toes opening, toe extension, as we're getting that dorsiflexion and eversion, and coming up. Good. And then coming down, same thing. We want that distal movement first. So toes in, toe inversion, and plantar flexion as we come down into hip adduction, extension, and external rotation. Good. So down and in, and up and out. Good. Down and in, up and out. And now I'm going to start applying some resistance to the patient. So down and in, push down and in. Good. And then up and out. Very good. Down and in, curl those toes down. Good. And up and out. So with PNF, rotation of the involved limb is a critical component, and we want to ensure we don't forget this part of the PNF pattern. So when I want to use repeated contractions with this particular pattern, whenever she gets to a point in the range, whenever she's fatigued, and I'm applying resistance, so push, 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 up and out, up and out, up and out. Good. So say she's fatigued at this point, I apply a quick stretch, and then give her a little bit more range. Good. Then down this way. Good. Push, 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 push. Good. Good. All right, Miss Allison, so we're going to use a technique called PNF. Essentially, it's trying to move the limb through several different kind of complicated movements. It's not moving kind of in a simple single direction. It's kind of going in several directions at once. It's more of a complex motor pattern as opposed to trying to isolate one muscle or one joint at a time. We kind of want to get a lot of stuff going at the same time. So do you recall that pattern that I taught you with the D2 lower extremity? Can you show me that? Very good. Toes down and in. Good. Good. And apply some resistance. Good. And then up and out. Very good. Alright. And doing the same technique, applying resistance with that D2 lower extremity pattern. I'm going to apply a little bit of kind of a stretch from the other direction when you're coming up. And in theory, it's going to kind of help your muscles kind of turn on to be able to help you get a little bit further into that range, okay? So same thing, just up and out. Good, 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 good. Push, 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 push. Good. Down and in, down and in. Push, 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 push. Good. Keep going. Good. Up and out, up and out. Push, 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 push. Good. Down and in. Push, 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 push. Good. Repeated contractions are useful for helping the patient when they are weak at a specific point or throughout the whole range. The quick stretch is used to reflexively activate the fatigued muscle. Following are several sources providing evidence for the use of PNF techniques in various settings. A study in 2001 in the Journal of Orthopedic and Sports Physical Therapy investigated the effects of proprioceptive training incorporating principles of PNF versus traditional training in soccer athletes. The study found that the incidence of arthroscopically verified ACL lesions was lower in the proprioceptive trained group. A 1994 study in physical therapy investigated the effects of PNF applied to the pelvic region on the gait of 20 patients with hemiplegia. Those with short duration hemiplegia had improvement in gait speed and cadence immediately after one session of PNF, and they improved more after 12 treatments. Subjects with long-term hemiplegia did not have the same short-term benefits, but had similar cumulative effects in the long term. A 2002 study in Prosthetics and Orthotics International compared traditional intervention for prosthetic training for patients with transfemoral amputation versus PNF techniques on weight bearing and gait. Prosthetic training based on PNF was more effective in improving the patient's weight bearing and gait when compared with the traditional program.